Nerves, 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 providing better understanding of the nervous system, a project facilitated by Connie Hill, RN. Good day. My name is Connie Hill. I'm a registered nurse currently working as a staff nurse on a med-surg pediatric inpatient unit. This project is the culmination of my educational goal of acquiring my master's degree in nursing education. This master's in nursing education capstone project focuses on the development, implementation, and outcome evaluation of a learning tool created for this purpose. The setting of this project is phase 2 of the Army Practical Nurse course with the practical nursing students as my target learners. By interviewing practical nurses that I currently work with at the target institution and researching past exam scores, a need was identified for the development of an innovative learning tool to enhance learning and comprehension of the material contained in the nervous system module. The primary goal of the project was to provide students with a tool that utilized a variety of learning strategies. When researching possible solutions, the WebQuest was the platform that I chose for this project. The WebQuest was developed for this purpose using Zoonal.com. The structure of this course differs from that of the civilian courses since these students have mandatory military duties and soldiering skills added to the stress of an intense academic and clinical experience. Students generally range in age from 17 to 35, which creates a vast difference in preferred learning style, their maturity, and their coping skills. They also have additional duties such as cleaning details, flag duty, class leadership, and mandatory military training to add further stress. The passing grade for all of their module exams is 76%. The primary stakeholders identified in this project are the practical nursing students themselves. The academic success of each student forms the foundation for the future of a successful educational and nursing career. And of course, many of these students are going to end up continuing to higher levels of education. Other stakeholders identified were the leadership and faculty of the institution, the future patients that will be cared for by these students, and the Army. The leadership and faculty of the institution assume responsibility of providing the best academic environment possible within established limitations. Faculty is charged with ensuring successful completion of the program, passing of the NCLEX PN, and providing the Army and the field of nursing with the best trained soldiers and nurses possible. Future patients benefit from care provided by nurses with a better understanding of the medical condition. Let me get into the theoretical basis that I use for this project. Learning results from a significant alteration in mental processing, behavior, and emotional functioning that's established from experience. Because this course involves the learning of adults, the primary theory that was applied to the development of the project was the adult learning theory. Andragogy is a term used to denote the education of adults. This concept was first introduced by Malcolm Knowles in the early 1970s, and it uses a constructivist approach that allows adult learners to draw on previous experience to help them develop new knowledge. Characteristics of the adult learner is that they're self-directed, they have prior life and work experience, they have a need to relate learning to real-world problem solving, they tend to be more internally inspired rather than driven by external motivators, and they learn best when there's an identified demand and inspiration. They need to know why they're learning and what they're going to benefit from it. Applying the principles of the adult learning theory can enhance nursing education by allowing the instructor or facilitator to assume more of a background guidance role and give the students more freedom and responsibility for their own learning. Modification from teacher-centered to learner-centered instruction techniques improves outcomes and increases the transfer of knowledge. Adult learning theory uses problem solving with the emphasis on subject matter pertinent to the current needs of the learner. Nursing researchers and educators can easily apply these principles to link theoretical concepts to clinical practice. Also, supporting the adult learning theory is that we have new innovative technologies. They're constantly changing the way nursing students learn. Students can now download textbooks and learning tools directly onto their computers and tablets that they have available to them at all times. YouTube videos are used as virtual teaching scenarios. Social media applications allow students to connect all over the world all the time. We must learn to integrate these tools to allow the individual learner to use their creative strengths in this new collaborative environment. The adult learning theory principles also complement ideally with the current world of technology and availability of all this information. As an inquiry-based learning tool, the WebQuest is a creative activity that stimulates critical thinking and problem-solving skills using the computer-based design model. The creator filters this web-based information to engage the learner to collect and synthesize information for the enrichment of their understanding through analysis. Because of this flexibility and 24-hour access, the WebQuest was chosen for this project, and also to increase the variety of learning engagement to enhance comprehension of the material. The leadership strategies applied in this project, development and completion of this project has provided me with a fresh perspective on the enormous responsibility of leadership and that is embodied in the position of the nurse educator. Interaction with students and faculty members of the Practical Nurse course provided me with a great understanding of the immense need for passionate and competent educators. The nature and environment of the project required collaboration with a broad range of faculty, from the director of the program to the instructors, students, administrative, and IT staff. The leadership provided by my project mentor was imperative to the successful execution of this project. Several of the strategies that were employed during the development of this learning tool was important to develop a tool utilizing a variety of learning activity formats to target different types of adult learners. And then the evaluation was accomplished through student and mentor evaluations and also statistical comparisons of exam scores. Resources used for the development of the actual WebQuest used as the learning tool some were from websites, of course. That's part of what a WebQuest is about, and YouTube videos. Collaboration with instructors, especially the lead instructor for the nervous system module, was imperative to identify weaknesses and develop the WebQuest content. One of the limitations encountered early on was a limited timeline due to strict scheduling of the course. Because it's a military training, there were also some limitations on content. Much of the material was extracted from the actual instructional modules content, but was presented utilizing other resources and tools such as Powtoon, Blogster, and Voki that were embedded into the WebQuest. The faculty and mentor for the project were extremely helpful and understanding in providing access to the training materials that I needed for the development. The WebQuest was the chosen method of the learning tool, like I said before, because the students are able to access it outside of their rigorous training schedule at their convenience. For the implementation phase of the project, the lead instructor was instrumental in strategizing an effective way to present the WebQuest in a classroom setting. Flexibility of the WebQuest tool allows for modification as needed to fit the intended purpose. So the classroom is set up with computer workstations at each seat, and that allowed for the WebQuest to be presented during a scheduled period of instruction. I was able to provide an introduction and explanation of the WebQuest process, provide the WebQuest URL, and allow the students to work on it at their individual workstations. During the class session, the instructor and myself both remained to monitor and aid the students in navigation of the WebQuest as needed, or to answer any questions. To break the monotony and encourage collaboration, the 10-question quiz portion of the WebQuest was performed as a group activity. The students were broken down into small groups. Once the groups had completed the quiz, the answers and rationale were discussed. Because of time constraints, students were encouraged to record the URL and refer to the WebQuest at their leisure for study purposes outside of class prior to the exam. And then paper copies of the evaluation were distributed to be filled out and turned in following the exam. The identified project outcomes were: the practical nursing student will demonstrate increased comprehension of the human nervous system. The practical nursing student will evaluate and report increased comprehension of the material with the use of the new innovative learning tool. And the project mentor and instructors will analyze and express that the learning tool has effectively incorporated teaching strategies to enhance student learning. For the evaluation of the project outcomes, the practical nursing students' nervous system written exam scores average will increase by at least 2 percentage points in comparison with the last two classes. The result of this outcome was that the range of test scores on the nervous system module for the last class was 68% to 93%, with 3 failures and an overall average of 80%. The class prior to that, the range was 66% to 91%, with 3 failures and an overall average of 79%. For the current class targeted in this project, the range of scores ended up being 74% to 94%, with 1 failure and an overall average of 82%. For the purpose of this outcome, the evaluation criteria was met. The second outcome was practical nursing students will report increased comprehension of the presented material on the human nervous system after completion of the project learning activity by rating learning comprehension a minimum average of 4 on a 1 to 5 scale on their post-evaluation. The result of this outcome was measured by utilizing the evaluations filled out by the students and the faculty members following the implementation of the WebQuest. Evaluations were received from 25 students with an overall rating of 4.48 out of 5 on the rating scale. The evaluation criteria for this outcome was also met. The third outcome evaluation was that the project mentor and practical nurse student instructors will rate overall effectiveness of the learning tool an average of a minimum of 4 on a 1 to 5 scale on the post-evaluation. The result of this outcome was a little more difficult because the participation of the instructors was limited. There's only a limited number of instructors. There's way more students. So several instructors, including the lead instructor for the nervous system, was actively involved throughout the process. 4 evaluation forms were received with an overall rating of 4.5 out of 5 on the rating scale for overall effectiveness of the WebQuest tool. Based on this limited number of responses, the evaluation criteria for this outcome was met. The learner outcomes for the project facilitator, which was myself, are utilize clinical reasoning and knowledge established from evidence-based research and outcomes in development of educational materials, collaborate and communicate effectively with all stakeholders of the learning experience in the development of an effective student learning tool, and display professional nursing leadership and competency in the use of innovative educational techniques in the research and development of an effective learning tool. Evaluation of the learner outcomes were that the project mentor will verbalize successful implementation of clinical reasoning and evidence-based competency displayed by the MSN student in the development of the student learning tool, which was accomplished. The project mentor did verbalize. And the second one is stakeholders will rate the effectiveness of the communication and collaboration in the process of the learning tool development, and minimum average of 4 on a 1 to 5 scale on the post-evaluation following project completion. The result of this outcome was evaluated using the evaluation responses from faculty members. 4 evaluation forms were received, and the overall rating average was 4.75 out of 5 on the rating scale. The evaluation criteria for this outcome was met. The third one was practical nursing students and instructors will rate the quality, effectiveness, and use of innovative techniques of the learning tool, a minimum average of 4 on a 1 to 5 scale on the post-evaluation following the completion of learning activity. The result of this outcome was based on 29 evaluation responses received. The overall rating for this response was 4.6 out of 5 on the rating scale. The evaluation criteria for this outcome was also met. The outcomes were evaluated using statistical data of previous classes of students and evaluation forms provided to the students and instructors. Within the limitations of the project, all of the outcomes were successfully achieved. Patient and family-centered care is care that is built around a jointly constructive partnership between healthcare providers, patients, and families. As a team, they are all involved in the planning, delivery, and assessment of care. Healthcare providers understand the crucial role that families play in ensuring the health and well-being of not only children, but also family members of all ages. Emotional, social, and developmental support are recognized as essential elements of healthcare. The goal is to support the patient's health and well-being and ensure dignity and control is restored to individuals and families. It is a method of care that provides a foundation for policies, programs, facility design, and staff day-to-day interaction that delivers better health outcomes, more sensible allocation of resources, and superior patient and family satisfaction. Development of a tool to enhance the learning for this nervous system module was just a small part of the practical nurse course, and it resulted in the creation of a building block that may lead to development of learning tools for additional modules. For the stakeholders, improvements in the student learning process results in improved performance on exams to include the NCLEX-PN. Higher pass rates result in positive feedback for faculty performance and continued accreditation of the organization. As these students move on to practice and/or higher levels of education, a strong foundation built here provides improved understanding related to disease processes and future patient care performance. For those who decide to move on to other endeavors, either within healthcare or other fields of study, the Foundation for Learning Techniques will continue to provide guidance for future learning. The development and implementation process of this project may lead to the creation of additional new and innovative learning tools for use with additional modules for the practical nurse students. For myself as the project facilitator, the experience provided a significant opportunity for personal and professional growth. This was a learning experience that provided instrumental practice and proficiency required moving forward as a nurse educator. For the new nurse educator, sufficient groundwork is fundamental to teaching effectiveness and retention in the field. Coursework in the graduate nursing education program must incorporate material on diverse learning approaches, program strategy, classroom organization, and instructional skills to provide this foundation. Effective communication and expertise in teaching to facilitate students' learning is vital. Employing mentor support and encouragement is acknowledged as crucial elements of the transition from proficient practicing nurse to novice nurse educator. The decision to pursue a career as a nurse educator is reinforced by supportive mentoring, which encourages confidence and positive feelings for the new role as educator while attaining competency and experience in teaching practice. The process of recognizing a problem, identifying stakeholders, building a theoretical framework, and developing outcomes and solutions provides validity to evidence-based practice. This project outlined and explored this process on a small scale with a group of practical nursing students, promoting the professional development of a future nurse educator. With the skillful assistance and support of an outstanding group of faculty members and qualified expert mentor, The successful implementation of this project was accomplished.